Urine test for thyroid cancer recurrence monitoring. While thyroid cancer is relatively rare compared to other cancers, its incidence has increased significantly over the past few decades. One of the key aspects of treating thyroid cancer is monitoring patients for residual disease or recurrence after initial treatment. The most common method currently used for this purpose is to measure thyroglobulin levels in the blood. Thyroglobulin is a protein produced by normal thyroid cells and thyroid cancer cells. After a patient undergoes thyroidectomy and radioactive iodine treatment, thyroglobulin levels should ideally be very low or undetectable. Elevated levels of thyroglobulin in the blood may indicate the presence of residual thyroid tissue or cancer recurrence, making it a valuable marker for monitoring. However, current methods for measuring thyroglobulin levels in the blood have limitations. For example, the presence of anti-thyroglobulin antibodies in some patients can affect the accuracy of the test, resulting in false negative or false positive results. In addition, the invasive nature of regular blood draws can cause anxiety and discomfort to patients, highlighting the need for alternative monitoring methods. In thyroid cancer, exosomal thyroglobulin has emerged as a potential non-invasive biomarker for monitoring recurrence. Unlike circulating thyroglobulin in the blood, exosomal thyroglobulin is encapsulated within vesicles, potentially providing a more stable and accurate marker that is less likely to be affected by interfering substances such as anti-thyroglobulin antibodies. This new method involves isolating exosomes from a patient's urine and analyzing them for the presence of thyroglobulin. Early studies have shown that this method is highly accurate, with a detection rate of over 99%. In addition, because urine collection is non-invasive, it can significantly reduce patient anxiety and improve compliance with regular monitoring. The process of measuring exosomal thyroglobulin in urine is simple and convenient for patients. The test begins with the patient collecting a urine sample, and the concentration of exosomes in the urine is usually highest in the morning. Prior to the test, the patient may need to take thyroid-stimulating hormone, or take it with medication, or stop thyroid hormone replacement therapy. This step is critical because TSH stimulates the secretion of thyroglobulin, which improves the accuracy of the test. After the urine sample is collected, it is processed in the laboratory to isolate the exosomes. This involves centrifugation and other techniques to separate the exosomes from other components in the urine. After isolation, the exosomes are analyzed for their thyroglobulin content using a highly sensitive test. The urine test results can provide valuable insights into the presence of residual or recurrent thyroid cancer. Given the high sensitivity and specificity of the test, it can detect cancer recurrence earlier than current blood-based methods, allowing for timely intervention and better patient outcomes. In the cancer field, exosomes have received much attention because they can carry tumor-specific molecules as potential biomarkers for diagnosis, prognosis, and monitoring of cancer progression or recurrence. Exosomal cargo reflects the molecular composition of the original tumor cells, making exosomes a valuable source of information for non-invasive cancer diagnostics. For thyroid cancer, exosomal thyroglobulin has emerged as a promising biomarker. Because exosomes are stable in body fluids and protect their cargo from degradation, they can provide a more reliable and consistent source of thyroglobulin detection than free thyroglobulin circulating in the blood. Studies have shown that exosomal biomarkers can detect signs of recurrence months before they are detected by traditional methods. This early detection capability can enable more timely intervention, potentially improving patient survival and quality of life.